Hello, I am Dr. Basavaraj from Aster Whitefield, Department of Internal Medicine. So let's begin. I am going to talk on migraine today, which is very common symptoms we find day to day. So what is migraine? Migraine is a typical headache, which is like a unilateral or single one-sided headache, which comes like more than 4 to 5 times in a month, and which is getting relieved with the medication and which is not getting relieved with the medication. So what happens, like there are 4 phases of the migraine. One is like pre-DOM, aura, headache and post-DOM. This is what we call. So what happens, again there are types of migraines. One is like chronic migraine, menstrual migraine, vestibular migraine, retinal migraine and migraine with the brainstem aura. What are the common symptoms? I'm going to tell you in a normal layman language so that you understand everything. The pre-DOM, like you'll have a pre or symptoms like now you'll have headache, tingling sensation in the ear, so you'll feel that you're getting giddiness, vomiting sensation, and you are not able to concentrate on the studies. And other thing is that you you tend to sleep less in the night, and next day you'll have headache. These are pre-monitor symptoms you'll have. And what are the typical presentation? You'll have headache which is very throbbing type, especially the half headache. So what happens, like it is not getting relieved with the normal medication. What people normally go to the pharmacy, on counter they take paracetamol, they take 3 times 2 times, which is not getting relieved with the medication, and they continue to take medication after even 72 hours it's not getting relieved. Okay, this is called status migrainous. It's not getting relieved with the normal medication. That is the point where you need to contact doctor, not to go on the self medication. That is the thing. And other things, there are like sensory symptoms. That is called like you'll have sensory symptoms in the form of aura. That is like motor symptoms. Motor symptoms will be like you'll be having tingling sensation and you'll give headache. You'll feel vomiting sensation. These are the things. Only like visual symptoms. Visual symptoms will be like you'll be feeling the black dots in front of ears, and you'll have the flickering objects in front of your eyes. That is the one thing. Other thing is that you'll feel that the whole environment is not pleasant. You'll feel that it's unpleasant environment. That is the symptoms. And the other thing is, for all these triggering points are very, very important. So what happens, triggering points are the emotional stress, because everyone, we go under our professional life, which you undergo normal like day to day stressful things. One is like you're not sleeping properly on the day before night. Overnight you keep awake yourself, you take a lot of spicy food, like you go to movie, that is the one of the trigger point. You hear a lot of sounds, one of the flickering lights. Okay, and you, especially the people who take chocolates, caffeine related things, those are the triggering points. And even people just especially in the females, which is like the premenstrual syndrome we call. So before that also we'll have the migraine also. So there is all the triggering points. See, on taking counter medication, it's not the solution. So you need to contact doctor on the proper time. So what happened, I have seen recently a case which is like they have taken medication for 3 days, which is not reduced, and they came to me with a status migrainous. That is after 3 days it's not reduced. So that is called status migrainous. So these are the symptoms. So the main thing for the prevention is like you are getting headache. That is like 2 types. One is acute headache and chronic headache. Acute is that less than 15 days it gets subsided. Chronic headache it carries more than 15 days. It is the time that if you are a chronic migrainer, then you need to put on prophylactic treatment. That's very important. And whenever you feel that the triggering points, whatever I mentioned, if you are coming under one of the triggering point, then you have to be careful, and next day you have to take medication. This is the one thing. So we being internal medicine department, Aster Whitefield, we have all the facility to treat your migraine. Please do visit us. We are there to help you into 24/7. Thank you.